Most people think their hip pain is coming from their hip. However, in some cases, is actually referring from their back.
That's right. We know as therapists that oftentimes people that come with pain and say their back hurts, we always assess the hip to see if that's actually the source of the pain and vice versa. So we treat the proper area and get the problem resolved quickly.
We're going to show you how to tell if your hip pain is actually coming from your hip or your back. So oftentimes the location you're experiencing pain, if you're having real hip pain, is in the groin region, front of thigh, and sometimes it can go into the buttocks a little bit.
Also with hip, standing, walking, and climbing stairs can be a common irritant. However, that can be the same with back, but location of back pain oftentimes is more in the low back, this area in the buttock, around the posterior or the back side of the hip, running down the legs to the knee, and sometimes even down to the foot.
Hip pain referring from the hip joint itself, oftentimes it can be achy, sometimes sharp, but normally with activity, pain gets worse. So if you're standing for a prolonged period of time, walking or doing stairs, typically the pain will get worse the more you do.
On the other hand, back pain, low back pain, oftentimes the more you walk, unless it's very serious, but actually can improve the back pain. So people say, yeah, after I get walking, I'm up for a little while, it actually feels better. That is a good likelihood it's the back, not the hip.
Hip pain in the groin region, some common causes or diagnoses may be osteoarthritis, bursitis, tendonitis, hip impingement, or a hip labral tear.
Now, if it's low back, the structures or the tissues that are typically the problem are disc. We all know about a herniated disc. The facets, which are little joints between the vertebra, stenosis, which is a common cause. Typically, people over 55 or 60 may have that, or just tight muscles as a result of overactivity